Hi, and welcome to the Therap module overview. My name is Tricia Woods, and I'm a Senior Training and Implementation Specialist, and Sarah Christensen is with us today as well. The purpose of this video is to help agencies new to Therap better understand the modules that are available. We want to make sure you make the right decisions about what to include in your implementation plan. We will review a lot of these modules, but please note that you might not have all of these on your invoice, so you will want to confirm.
The first module we're going to review is the individual demographic form. This is basically like a face sheet within Therap. When you put information into the individual demographic form, it populates many different places in the system, as well as providing demographic reporting. Shared contacts is also part of the demographics. You're able to list professional contacts for individuals, and you can link those to multiple different individuals. Shared contacts also comes into play when you implement the appointments module within the health tracking section.
T-logs. T-logs are typically used as communication logs. They are written about the individual typically, but you do have an option to write them program-based. No setup is needed, so once you have your individuals and your users in the system, T-logs are immediately accessible. They are also accessible via the mobile application. Users can acknowledge T-logs as well, so you then get a signature to that T-log.
Health tracking consists of a variety of different health forms, such as vital signs, seizure forms, intake and elimination, and appointments. This information can also be put into a healthcare report, which aggregates all information for a particular individual. This doesn't require a lot of setup to start using, though you may want to enter shared contacts for the appointment section.
SCOMs, or what we call secure communications. This is user-to-user messaging within the Therap system. You can enter information that is just general, or it can be individual specific messages where you can actually attach reports and things like that about your individual. There's no setup needed for this as well. It's part of your system.
General event reports are the incident reports in Therap. The GER moves through a workflow that starts with somebody making the initial report, then it goes into a review process and finally gets approved. You also have the GER resolution module available for documenting investigations. And this requires very minimal setup to start using. Trend analysis reports are also available to users through event summaries in the report library. Some agencies may also have purchased business intelligence. And this gives you access to aggregated data across the entire agency.
ISP Programs and ISP Data. This is used for goal tracking and service logs. It consists of tasks and drop-downs that your staff are basically prompted and then need to answer. It's totally developed by you guys on how you want your ISP programs and or your ISP data to look. And you can also capture a begin and end time and can be used and linked to billing.
ISP programs and ISP data can also be accessed through the mobile app. We have Android and iOS apps available. I'll also add that there is an integration between ISP data and the scheduling AVV module, in addition to the billing integration. ISP programs must be created before you can start using this module, and you can use templates if you have a standardized way that you'd like documentation to look across your agency. There are also global templates available where you can download templates that other agencies have created and shared. Reports are available to analyze the data, including reviewing the narrative, the success rates, etc. And if you have DDO or data-driven outcomes, you can view aggregated data across locations and ISP programs.
Mobile applications. The mobile app now has T-logs, ISP data, and SCOM, is included in the subscription in order to use them. MAR and scheduling apps are included with the purchase of those modules. So those are additional purchases. Password reset functionality is included for all users. If you have apps included in your subscription, but you aren't able to access them, please write us through My Issues and request the activation.
Medication administration records are available in both the mobile app and the browser, and this is a way that you can document what meds are to be given and record the administration of them. Medication histories must be entered in order for this module to function. You may check if your pharmacy is able to interface with us. Certain pharmacy softwares we do have integration. You can link medications through our live drug database, which includes drug images, side effects, indications, and more. And MARs also include access to QA tools such as the due and overdue medications report. There are some other reports available as well.
Case notes. Case notes, they're less time to set up than ISP data. You can create templates prior to using these. They can be used for service documentation, clinical notes, nurses' notes, therapy notes. They can also be linked to billing and for billing purposes. And you have the ability to create a questionnaire as well. These also have the ability to do a bulk PDF when needing to get your information.
Okay, billing. Billing is typically not a phase 1 module. Billing modules will not be activated until you're ready to begin billing training. In order to get billing up and running, you must enter service authorizations to document how many authorized units are available for each service line that an individual is receiving. And then various methods of billing data collection are available. The options include attendance, ISP data, case notes, EVV, and directly inputting your billing data. So, if you're looking to implement billing, it's worth having a discussion with your implementation specialist pretty early on about what method you think is going to work best for your situation. You might use several for different services. Billing also includes the access to utilization tracking and reconciliation reporting. And in certain states, we have electronic claims submissions where you can do all your billing completely in Therap.
Training management system. This is used to track completion dates and due dates of employee certifications. Users can sign up for upcoming training sessions as well. This is called TMS, or Training Management System, and a way to track an HR component where you can track staff certifications.
Personal finance is used to track individual spending. You can upload receipts and run reports to see all of the expenditures an individual had within a given time frame.
Time tracking. This is an interval-based data collection that can be done overnight. It can be used for sleep tracking, behavior tracking, repositioning, toileting, and they have some great reports that are available for reviewing your data. They're color-coded and such.
The behavior event record and behavior plan is one option available for behavior tracking. Many agencies use ISP data and time tracking for tracking behaviors as well. Definitely check out our webinars to learn more about all the different options that exist for behavior tracking.
Health Plus modules. This is an additional purchase, but it does include individual care plans, health screening, a way to track recommended screenings and whether they've been completed or not. We have an e-chat, which is a comprehensive health assessment tool with an overview of the body systems and focusing on health risks for our population. We have orders module. This is a great place to store and track dates for non-med orders such as diet, PT, OT, adaptive equipment. There's ability to track dates of consent, such as HIPAA release, photo releases, psychotropic meds, and then individual history. It develops medical, social, and family history from use of this module.
Document storage. Document storage includes both an individual and agency-based storage option and is often used by agencies who are going completely paperless and trying to store all aspects of their documentation in Therap. One attachment in the document storage module can be up to 10 megabytes, and your total storage is based on what your agency has purchased. You can create categories of documents, track validity, and so forth.
Individual support plan module can be used to create person-centered plans directly in the system, or you can upload plans that you receive from outside sources. Users can acknowledge the plan, so you basically obtain a signature that they have read the plan for the individual, and you have the ability to run an expiration report, 30, 60, 90-day report on when the support plan is to be expired and monitored. This includes a personal focus, can include, you don't have to include it, a personal focus worksheet to assist with your planning. It's basically an example here is it gives questions and you're able to answer it and add them into the agenda of your meeting if you choose. So it's kind of a meeting planner, I like to call it. Also with the individual support plan is the ISP agenda that is used in planning your meeting topics and recording minutes.
Charting the LifeCourse provides a person-centered framework that includes several tools as part of a comprehensive approach of planning for an individual and or the individual's family. So there's a life trajectory, integrated support star, and vision tool that are available to use as part of this module.
Staff action plan. This is a New York specific module for service plans. So if you're in New York, it will be familiar to you. Otherwise, it's a not needed module.
Scheduling an EVV includes staff schedules, especially for community-based and in-home services. This includes EVV, and schedules are optional for EVV. So you can use this module using a self-check-in method if you prefer not to create schedules in advance. We have interfaces with several state EVV systems, and this module can also help in tracking staff hours. It does link to billing service authorizations as well as the ISP Data module. So you can bill directly from the EVV times to ensure that you're never billing without corresponding EVV.
Employment history. This is a way of tracking employment milestones such as interviews, job placement, 30-day job placement. You can track where individuals are and where they've submitted applications, whether they've had the interview, all conversations included. It also tracks history of jobs and volunteer positions through a job bank.
Priority list offers a way to track potential new clients. You're allowed to create categories for priority, status, exit reason, and so forth. And you could also include questionnaires as part of it.
The IPOP, Individual Plan of Protective Oversight and Safeguards. This is a way of tracking risks and safeguards for the services individuals receive. You can do it through home, through your work, in the community, so you can set up different IPOPs per area.
Custom Forms is a library of different forms that Therap has created that you're able to import into your account. Examples include personal property forms, nursing assessments, and aspiration risk forms. Custom forms are typically created for statewide forms, so if you have forms that are specific to your agency that you'd like to get into Therap, Questionnaire and ISP Programs are both great options for those.
And we do have a calendar built into Therap. This is a program-based calendar that can be used to track events. It should be used for events pertaining to an entire program, such as staff meetings, maybe quarterlies due, monthlies due, things like that.
All right, and the individual homepage is a launching point for documentation. This isn't necessarily a module in and of itself, rather a way that your staff can come in and access various modules they have access to. So this is person-centered. It shows all forms available to complete for an individual and includes links to their individual demographic form, their plan, and so forth. So thank you so much for watching this module overview. Hopefully you found this beneficial in terms of planning your implementation. Have a great day.